still allowing 75% of women to become invasive before we find it. Is there some way to find in situ cancer? Currently, the only ways that I know of are rodeo MR or regular MR. Rodeo probably is a little better at finding in situ disease, and ductal lavage. Ductal lavage is finding a few carcinoma in situs. So anyway, the case for more mammography, but the biggest obstacle is getting medical directors of health plans to pay for it. We have about a 50% reimbursement rate, and it's because they cannot get out of this thinking. And I'll write back and I'll do my letter to them. This is not a screening diagnostic tool. It is a risk assessment strategy, blah, blah, blah. And they'll write back and say, we don't feel that the evidence for screening and diagnosis is good enough. And you just go, you can't get them out of that. There's no paradigm shift. There's not any realization at all. And we've met with medical directors face to face, letter, telephone, and it's pretty impressive. The other thing that I get not a kick out of, the frustrating thing, is when they write back and say, we already have established risk factors. Why are you doing this? And I say, the historical risk factors are surrogates. When your sister has breast cancer, that means your increased likelihood of atypical cells, but that doesn't mean you've got them. The real thing is what's going on in the cells of the breast. And so that's the blockade. We got to get people to think out of the box, and here's my picture of the medical directors trying to get out of the